Hello, my name is Rajdeep and today we are going to present our capstone project part 2. So we are three members in our group, Munshit Kaur Navdeep and me. So introduction and objectives. The goal is to raise Sunrise senior living's hand hygiene compliance from 65 to 90, 65% to 90% in 6 months. So, why this topic? Healthcare associated infections can be avoided by practicing good hand hygiene. Both cost saving and patient safety depend on compliance. Next is significance in Canadian medical care. In order to avoid infection, hand cleanliness is a top priority for the WH and Canadian Public Safety Agency. So next is identified barriers. First is time limitations. So nurses and healthcare workers often have high workloads, making it difficult to follow proper hand hygiene protocol consistently. Second one is knowledge gaps. Many healthcare workers may not be fully aware of when, how, and why to perform hand hygiene correctly. Third is cultural barrier. So different cultural backgrounds and experiences influence attitudes and perceptions toward hand hygiene. The last one is accountability problems. Lack of real time monitoring means staff members may not feel the immediate consequence of non compliance without supervision or uh, peer accountability. Hand hygiene practices can become inconsistent. So, proposed solutions, multimodal strategy. Seminars and learning through simulations are used in education and training. Visual reminders, electronic advertisements, and signs at hand hygiene stations. Next is administration participation, conducting compliance audits and leading by examples, peer observation and monitoring. So, in this, encourage real time feedback from colleagues, create a culture of accountability, availability of resources. So, ensuring sufficient availability of hand hygiene, sanitizer, soap, dispensers, and sink is crucial. If hand hygiene stations are not easily accessible, staff are less likely to comply with the hand hygiene protocols. Application of nursing theory health belief model. So, perceived danger. Next is advantages expected, confirm lower infection rates, indicator to interventions, leadership teaching and visual signs, self confidence, motivate nurses to practice good hand hygiene.
So next is implementation plan and execute. We will begin by involving key groups. First of all, nursing leaders, infection control teams, and frontline staff. Nursing leaders will guide the process, infection control teams will handle audits, and staff will implement practices. We will introduce audits, training, visual reminders, and real time monitoring to boost compliance. This will be rolled out at Sunrise Senior Living, starting with a 3-month pilot and followed by a 6-month evaluation. Our goal is to increase the compliance from 65% to 90%. Next is assessment outcomes. We will measure the success using both qualitative and quantitative data. Staff surveys will assess their perceptions and satisfaction with the program. We will track hand hygiene compliance rates and infection rates before and after the implementation. Weekly audits will provide ongoing feedback to ensure continuous improvement. Next is addressing barriers. We will be addressing key barriers such as time constraints. We'll allocate specific time for hand hygiene during shifts. Knowledge gaps. Ongoing simulation based training will enhance staff knowledge. Accountability, peer feedback, and leadership modeling will reinforce compliance and create shared responsibility. Then there is the effect on stakeholders. The initiative benefits everyone. First of all, staff. They'll gain confidence with reduced stress from the fewer infections. Next, leadership. Increased accountability and better compliance. Then, patients and families. Reduced infection risks leads to higher trust and safer care.